You are watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Hot topic, bioidentical hormones. With us, we have a compounding pharmacist with strong opinions about the topic. He's the desert's compounding pharmacist. I know him as Yemi. Is that what they call you, Yemi? Welcome to the program.
Thank you very much, Randy.
Everybody calls you Yemi, right?
That's right. It's my full name is actually Adeyemi, but they call me Yemi for short.
Okay, good. Now, for people that don't know you, and you're a funny guy, by the way. You laugh all the time. Do you do that with the patients that come in?
Actually, in the profession we're in, it's very tough. So you got to have a good sense of humor,
Okay.
That keeps you going.
You laugh a lot with the...
You bet.
Because you're known for your laugh. You're always laughing.
Actually, yeah, because life is too short.
Okay, good.
You got to have fun with what you do,
And you love what you do. So let's talk. For people that don't know you, you have 3 compounding pharmacies.
Yes.
In the desert. Where are they located? And also, what are the services you offer as a compounding pharmacist?
We actually have 3 locations, one in Palm Springs, that's actually called Las Palmas Pharmacy.
Okay.
And we have another one in Palm Desert called Fireside Pharmacy. And we open another one, La Quinta Pharmacy.
Okay.
And basically, we are very passionate about compounding. And we actually also want to provide good service to every patient and every doctor in the desert.
Okay, good. Now, let's talk about some of the things you do, because when I think of a compounding pharmacist, I usually think of bioidentical hormones, but you do a lot more than that. I mean, veterinary. Why don't you tell me? What are the different things you do?
Exactly. Compounding is just not limited to bioidentical hormones alone. We also do veterinary medicine, veterinary compounding.
Like what? Pain? I mean, what's the hot thing for animals? Like, let's say dogs right now.
Yeah.
What would you make for dogs?
Yeah, one of the things that we make for dogs is what we call, there's a product called metimazole, which is meant for their thyroid. And what we do, there's a very innovative way of dosing that, whereby instead of giving the medicine orally, you apply the medicine directly to the earlobe. And that actually penetrates and go into the bloodstream. Okay. So you don't have to struggle with the dog to dose them. You just apply this medication directly on the earlobe.
Okay. And we talked also, so you could, as a compounding pharmacist, I mean, you make formulations even for skincare.
Yes.
What's hot is these biopeptide creams. It's like Botox.
Yes.
Does it work though?
Yeah, it sure does work because, one of the good things about being a compounding pharmacy, especially a clinical compounding pharmacy, is because you get direct feedback from your patients. Okay. If something doesn't work, they tell you it doesn't work. When something works, they come back and say, wow, that really worked like a charm, I really love what you made for me last time. So it's very fulfilling. So we have direct feedback. When I say something works, believe me, it works.
Now, I love Botox. I go to Dr. Mo Zachary for my Botox. But you're saying if I rub this cream on,
yes,
it's going to freeze the muscles. Is that right?
What it has is we make them with a very high concentration of biopeptides. Biopeptides, like they have the similar mechanism of action like Botox. Getting it from Dr. Mo is great because we actually work in collaboration with the doctors in the area. Okay. So I wouldn't say you shouldn't.
But is it a temporary fix? You do it like every day?
Yeah, you do it on a daily basis.
And so it keeps it?
It just maintains it.
And what are the people saying that get that?
They love it. They even come back and say, you know what? I want the serum. So they come back and get the serum, whereby they apply those serum. It's like a liquid. They apply it to the fine lines. So anywhere there's fine lines, they apply that to tighten it up. So it works really well. I have patients on it that they keep coming back. When people keep coming back for something, it means it works.
Okay, good. Yeah. So what, we were talking before we came on, you said people are really coming in for certain things that you make. What are they?
We make anything for pain management.
Pain management, okay.
We could combine a non-steroidal anti-inflammatory drug with a muscle relaxant, with something to calm the nerves down. We even combine it with some local anesthetic. So in a pain gel, you could have maybe 4 to 5 ingredients that have different mechanism of action to control the pain. That's the beauty of the pain gels, because you could combine a lot of things to actually take care of the pain, because pain could be due to so many reasons. You could have
Okay.
neuropathic pain, which is not responsive to a non-steroidal anti-inflammatory drug like Motrin. If you have a neuropathic pain, Motrin is not going to work for that. So you need something to calm the nerves down.
Okay.
Then also, when you have a bone pain, if you keep taking gabapentin, which is meant for nerves, it doesn't work for that. You need a non-steroidal anti-inflammatory drug. Some of the things that we use is like ketoprofen. We use that.
And these are creams?
These are gels. These are creams.
And you rub them on the area that hurts?
You rub it directly on the spot where it hurts.
Okay. So if a patient's watching this, they could call you and you'll connect with the medical doctor?
Yes.
The pain management doctor that is doing it?
Exactly. We'll work with the doctor because we have to give the information to the doctor, but the doctor is still going to take the information and make a decision based what is best for his patient.
Okay. Now there's going to be a lot of people that watch this show. A lot of doctors watch this show. They don't like to admit it sometimes, right? But they watch the show and they've heard about you. Maybe they even send you patients. But what do you want doctors that don't know you to know about?
I want the doctors to know that we're a great resource for them.
Okay.
And I want them to understand that we're very professional. We don't switch their prescriptions. So if they prescribe something for their patients, they should be aware that when the patient goes to any of these pharmacies that we own, they're going to get exactly what they prescribe. Okay. And also, we don't upsell their patients. We don't.
What does that mean? What do you mean by that?
Upsell. What I mean is, like, if a patient walks in and say, my doctor tells me to come and pick up CoQ10, we give the patient what the doctor wants them to pick up. We don't sit them down and start trying to give them more than what they don't need. Okay. So I think a lot of doctors appreciate that about the fact that we're very professional.
Okay.
And we always do things in the best interest of the patient.
Okay, good. Now, one of the things, and people need to know, it's a real interview. I'm not necessarily trying to side with you on this show, but one of the organizations that I have respect for is the American Academy of Anti-Aging and Regenerative Medicine. And very few people know that. I mean, you are board certified with this organization. You are fellowship trained about supplements, about eating, about stress,
yes,
about the gut, about adrenals. I mean, why'd you get involved in that as a pharmacist?
Actually,
are you the only one, by the way, the only pharmacist that you know of?
I think so. I think probably the only pharmacist with fellowship in anti-aging, regenerative and functional medicine in the desert.
Okay.
And the reason why I did that was because I want to be a good resource for the doctors. I want them to be able to, I actually want to be able to actually speak their language as well, understand what they want. In that way, I could be able to better serve their patients.
So if patients come to you and have nutritional questions, or they're saying, tell me about CoQ10 or whatever,
yes,
will you come behind the counter sometime? I mean, you'll educate them on supplements or whatever.
Exactly. We actually take that very seriously, because when a patient comes in and asks you a question, they must have actually thought about this all along before coming in. So when a patient walks in and asks you that kind of question, you want to be able to actually be able to go out there, spend as much time to answer all their questions and point them in the right direction, because they want information. That's the reason why they are here. And when you go to any of these pharmacies in Palm Springs, Palm Desert, and in La Quinta, you'll be able to get that kind of service.
Is that right? You like, obviously, I mean, you have a lot of training, so you like when they ask you questions.
I sure do, because it's more of being, that's one of the reasons why I did the fellowship training, because I want to be able to provide knowledge.
Okay.
Give good information to the patients when it comes to the nutritional supplements, when it comes to what kind of compounds they need to use, when it comes to even the traditional medicine that they use. People come in with a bag of medications that they take and come to us and ask us, Yemi, I need you to help me take a look at all these medications and see which one is conflicting with each other. So we take care of just the traditional medicine, the traditional prescription drugs, and also the supplements. So we tell them, this is what you're doing, this is what you're doing wrong, try to do this. And we actually don't take them off their medicines, though, because that's actually prescribed by their doctors, unless it's a duplicate. And when there's a duplicate in therapy, we'll give the doctor a call to let them know that, are you aware that this patient is taking this duplication of therapy? The doctor probably says no.
Okay.
So the doctor will actually be able to give us the direction or authorization to discontinue one and let the patient continue to take the other one.
Now, the supplements you carry,
Yes.
like vitamin and mineral supplements, some of the herbals and things like that, are professional brand. I mean, these are, in fact, one of my favorite supplement, Designs for Health, you carry in your,
Yes.
in your, along with a bunch of other supplements.
Yes.
So what do people need to know about the supplements you carry?
We carry hand-selected professional lines. And the reason why we do that is because you want something therapeutic. You want something that the patient would take that is going to work. Because it's not what you take that matters. It's the quality of what you take.
And the dose, is that correct?
And the dose, exactly. And the dose. Because a patient will walk in and say, you know what, I'm taking these fish oil capsules. And I'm still having all this bunch of inflammation in my body. My question to them is, where did you buy these fish oil capsules? And they'll tell me, oh, I got in Costco, about 365 pills for about $5. I'm like, this is not the right supplement for you to take.
Yeah, because not all fish oils are the same. Is that right?
Not all fish oils are the same. Not all fish oils are the same. And that's the reason why patients take it and they don't get any result. So when they don't get a result from something, it's time to quit it, discontinue it, and switch to a better line. So some of the things that we do is to actually be able to evaluate. Usually, like I told you in the very beginning, that we get feedback from patients.
Yeah.
When I recommend something and patient comes back and tell me, I'm actually getting experience through that as well. So
Nice. I see what you're saying.
So we carry a lot of professional lines.
My buddies that are medical doctors,
Yes.
they always say the compounding pharmacists are in a better position than we are sometimes. They said because we only hear when things are going wrong. But when things are going great, they don't call us.
Yes.
And they always tell the pharmacist.
They sure do. They come
like
back.
I have more energy.
That's right.
I have better libido or whatever.
Yeah, that's right. They come back and give us the feedback. Some of them, most of them are positive, and some that are negative. What we do is we make an adjustment.
You told me about customer service, and we could, this is a big topic. We talked on the phone, and one of the things I liked about you is you said, Randy, once people try us and come to us, even if they make a switch, they want to come to us forever.
That's why
I go, do you believe that?
Yes.
You said yes.
Yes. When people try us, they'll never go back to the rest.
You believe that?
I sure believe it, because you see, we are big on relationship.
Okay.
I'm very huge on relationship, and it trickles down from the top to the bottom. When the owner of the pharmacy is actually big on relationship, then other people, the staff, they start embracing that. And one of the things I emphasize is this, that everybody that walks into our store, we have to treat them like a family. Because, give me a break. How would you, there's no way somebody would do business with you if they don't have a good relationship with you.
Yeah. You told me this on the phone, by the way, not to interrupt, but when we hung up, we had our pre-production meeting, hung up, and I wanted to talk to the Wellness Hour team about customer service. Because one of the things you said, which most of us have heard before, but you said people like to do business with people they like.
That's right. That's exactly right. It's all about relationship. It's all about taking care of somebody who's old enough to be your mom. You treat them like your mom. Somebody who is old enough to be your dad, you treat them like the way you're going to treat your dad.
And I think, one of the things too, I think that is important for people to know is that, a dentist, sometimes you just want to go to the dentist and leave. You don't want to necessarily a friend for life. But with a pharmacist, if you have a cold, or you have a question, or you have an ache, it's good to have a friend that's a pharmacist.
That you
and
could
frankly,
call.
when I have a problem, which is rare, about whatever it may be, I call a pharmacist oftentimes.
Because we are very accessible.
I called you recently with a problem.
That's right.
I had a question about.
That's right. And we talked at length about it. Spending time with somebody that you have relationship with, spending time with people that comes to do business with you, it's not a time that is not well spent. It's a time well spent because people need help. And when people need help, you have to be compassionate.
Okay.
You have to go out of your way to help them out. There's so many instances whereby we're already closed for business and I'm still there calling patients.
We're a little short on time, but I want to talk a little bit about bioidentical hormones because there are still people that are skeptical about this and supplementation. Do you see people that with combination of, healthy eating, stress reduction, supplementation and bioidentical hormones have you seen reversals in like conditions or people that were lethargic and now they have lots of energy, people with no sex drive and now they have sex drive?
Yeah.
Give me your thoughts on that because as a compounding pharmacist, like we said, you're the person when things are going good, you know about it.
That's right.
And the doctors sometimes only hear when things aren't going good. So tell me about that. Is it really working? That's what I want to know.
It's really working. And a lot of patients are embracing it because when you feel good, you want to continue in that direction.
Okay.
When you feel good, let's say you're feeling bad, and you come in, your doctor prescribed some bioidentical hormones for you, which might include progesterone, testosterone, and biased, which is a combination of estriol and estradiol.
Okay.
And sometimes they even touch on thyroid. When doctor prescribe that for their patients, and they start using it, and they feel good, they continue in that direction. And I always get positive feedback that, wait a minute, this thing has changed my life. This
really?
Saves my marriage. Some people tell me that, I hear a lot of things, a lot of good feedback. So it's very fulfilling for me. I really enjoy when people that don't feel good, all of a sudden they are feeling great, It's working. Come to your question, it's working and people love it.
Now, do you think people will live longer? It's hard to prove at this stage, I guess. But people may be living longer because of some of the nutritional supplementation and bioidentical hormones and things like that?
People misinterpret anti-aging as they're not going to die. That's not what anti-aging is all about.
Okay.
You're still going to die. Everybody is going to die one day. But you want to maintain a good quality of life in your golden years. Okay. That's the whole essence of it. So I'll give you an example. You have two patients. One is not proactive about his health. He's not taking supplements. He's not balancing his hormones. He's not doing anything. He's just saying, I'm old. That comes with old age. And you have another patient that is very proactive. He's taking supplements. He's balancing his hormones. He's exercising. He's eating right. Then who is going to be able to go on a cruise at a later
Good point.
date?
Like 70, 80 years old is young today, especially in the desert.
Yeah.
Okay. So that's a good point.
Yeah, who is going to be able to go on a cruise walking into the cruise ship? Or somebody is going to be taken by wheelchair into the cruise ship. The person that is very proactive, because it's better for you to really prevent diseases from happening before it happens.
Were you skeptical, like at one point after pharmacy school, about bioidentical hormones? I guess what I'm trying to say is, you've seen so many results. I guess life-changing results.
Yes.
Are you at a point where you're saying more people need to know about this?
I'm not skeptical about this. This is a good thing that has happened in people's lives. Because when you look at it, before, you probably heard about grumpy old men.
Yeah, Grumpy Old Men, the movie.
People were grumpy, maybe due to the fact that they have a low testosterone level.
Yeah.
But now you see people, they are not grumpy in their old age anymore because they are supplementing. This is called hormone restoration. You're restoring the hormones to optimal level to give you a good quality of life.
Okay, and so you make these, as a compounding pharmacist, you make these customized, I guess, medications.
Yes.
Is that right?
Yes. There's no one size fits all. Everything that we make in our pharmacy is actually prescribed by the doctor, and every prescription is different for each patient. So we actually make this, customize it for that patient.
Okay, for example, with testosterone in particular. Okay,
Yes.
so the drug companies are now in on the testosterone. How is a compounded testosterone different than like that gel that the drug companies offer? That's my question.
The testosterone is the same because we work from we work with the same active ingredient, testosterone, that the manufacturers are using.
Okay.
And these ingredients are all FDA approved ingredients.
All right.
Okay. What I mean, that doesn't mean the compound, the end product of the compounded product, it's FDA approved. Okay. But the ingredients that we use, they are FDA approved. Because I hear this that, oh, Yemi, the compounded medication is not FDA approved. That's correct.
Are there any other differences though?
Yeah, the difference might be a situation whereby we could customize this based on what the patient needs. So you could have a doctor that wants to prescribe his patient like a 10 milligram testosterone. So we could make 10 milligram for that patient. And you could have a doctor that wants to give his patient 50 milligram, then we could make that 50 milligram. And we could even go through making it in a different formulation. We could do like a gel for topical application. And sometimes we could even make it like a troche, whereby it dissolves under the tongue.
Really?
Yes, we could do that.
With testosterone?
With testosterone.
Is it effective?
It's effective because we're making a very tiny little bit whereby you don't end up swallowing the testosterone. Because when you swallow the testosterone, it doesn't work as much as when it's being used topically.
Okay. Now, what if somebody, a lot of people are moving into the area in the desert, or they don't have a integrated medicine or anti-aging doctor. You have a list of doctors that you work with?
We actually have
believe in nutrition, supplementation, bioidentical hormones when indicated.
Yeah, we actually have a lot of doctors. We work with a lot of doctors in the area. We work with, if you go on our website, or FAARFM.com, you're going to see some of the doctors that we work with in the area.
Okay.
If you go to the health practitioner side.
Okay.
Yes.
Okay. So shows like Dr. Oz. Patients now are more informed than ever before.
Yes.
So now they must be coming in and say, well, Yemi, Dr. Oz said that cinnamon is good for reversing diabetes. Are you equipped to handle these type of questions?
And that's the whole essence of me doing the fellowship in anti-aging and regenerative medicine and functional medicine. The whole essence of it is to keep abreast of what is going on.
So you, without giving me the answer, but you know some of these answers. Because my question is always the mechanism. I called you about something, asking you why it works. I mean, you know as a pharmacist, I guess, why cinnamon might be good on the insulin receptors or whatever, right? So you know this type of stuff?
I know all this. I have all this information. And not only cinnamon is being used, there's berberine. Berberine is being used also to control your blood sugar these days. So when all those things, all those journals, I read a lot about them.
Like curcumin or turmeric. Do you carry that in your pharmacy?
Yes, we do. We carry
for cancer prevention.
Yes, we do. Because curcumin is very good. It reduces the inflammation in your body, in your gut. And when you have too much inflammation in your gut, it tends to actually cause a disruption in your flora, in your intestinal flora, also cause a disruption in your intestinal walls. Okay. So when you decrease inflammation in your gut, it lowers it strengthens your immune system because your intestinal junction and you have a good line of defense that are solid.
Okay, good. So you are, well, that's good. So you're, and we're almost out of time, but with patients watching this, if they're looking for a compounding pharmacist, they can go to one of your, do you float between the three? You have Palm Springs, La Quinta, and Palm Desert? Yeah,
I actually have about 5 pharmacists working with me right now. And all of them are well trained because we have to...
In nutrition?
Nutrition,
supplementation?
Supplements, and even compounding. They are well trained to answer the questions. And also I float. Most of the time I'm in the Palm Desert location, but I still go to the other stores to see some patients as well.
So we're out of time. So if you have questions about bioidentical hormones, they can ask you. Doctors need to know that you're going to work with them.
Yes.
And you said earlier that if they send you a prescription, you're not going to argue with the patient or
we don't change their prescription. We don't change their prescriptions.
Okay. And beyond that, you do veterinary. You do these special little creams that I'm going to have to find out more about that work like Botox. Right? And those require a prescription?
Yes, yes.
So you make cosmetic compounds?
We make,
for
yes, we do.
Dermatologists and
yes,
spas and things like that?
Yes, we do. Then also, we also do sterile compounding, whereby we make injectables. We actually have the largest sterile compounding pharmacy in the whole desert.
What does that mean? What does that mean?
What that means is like you have to have a special license for you to get into sterile compounding, and you have to be well trained, because it's a high risk kind of compounding, because all these medications you make, you have to make it in a sterile environment, because they are
you have the largest sterile environment in the desert.
Exactly.
Okay, I didn't know that about you. When were you going to tell me that?
Yeah, for sterile compounding. You see, you get.
How come you didn't tell me that before?
I think it's never too late, you know.
You don't like to brag, right?
No, I don't really like to brag, because to me, people, you have to be very humble in life. When you are humble, let people find out who you are. You know, don't brag about what you could do. Let people see whether you care about them. Then they'll find out you could help them a lot.
When we air this program, what would you like to see more of in your pharmacy? Would you like to see more questions coming from the patients? What would you like?
I would actually like for every patient that walks into our door to have a very good experience.
Okay.
I want them to have very good experience, and that's one of the things we listen to our patients. That's the reason why we opened that third location in La Quinta, in order for us to be able to better serve them, because
they were driving a long way.
They were driving from La Quinta, and a lot of them talk to me about it and say, Yemi, when are you going to open a store in La Quinta? So I keep hearing that ever since you know, you got to listen to your patient base, because they are telling you what is important to them. And when people tell you what is important to them, don't brush it aside. Listen to what they got to say and make an adjustment in what you do. And that's the reason why we open up the third pharmacy in La Quinta.
Okay, good. We're out of time. I want to thank you for coming on the show.
Thank you.
Very interesting. And I've wanted you on the show for quite some time. So
thank
thanks
you very
again.
much, Randy.
If people want to know more, they just go visit you. You're at the, I guess you travel around all three pharmacies, but spend most of your time in Palm Desert. So thanks again.
Thank you very much, Randy. Thanks for having me.
You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again online, go to our website on wellnesshour.com and you can put in Yemi. Easy to remember there, or Compounding Pharmacy, and you'll find them there. For now, I wish you could help.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.